एक मिनट. Gallbladder meridian mainly distributes at the temple, side of the neck, side of the trunk, middle of the lateral aspect of the lower limb. So, side of the head, neck, face, then it goes on the trunk, and then it flows through the which aspect it will grow of the lower limb. कौन से aspect से run होएगा? Gallbladder is what? Yin or yang?
Yang.
Which aspect of the leg it will pass through?
Lateral.
The lateral aspect of the lower limb. It originates at the outer canthus. See, this is called as outer canthus. Outer canthus. यहाँ से originate होता है, ठीक है? So it originates at the outer canthus. Then it ascends to the corner of the forehead. It ascends to the corner of the forehead. Then it follows this path. This is the first path. This is the first path. This is the second path. This is the third path. The fourth path, and the fifth path goes around the head like this. And the sixth path comes here and ends at the nape. Are you all समझ में?
Yes.
It ends at the nape. Gallbladder 20. It ends at gallbladder. This path goes at the gallbladder 20 meridian point, and from there it comes down and it enters into the supraclavicular fossa. Okay. Internal branch, then it moves from back of the ear. And then it curls around the ear. It goes upward, connects to the outer canthus. From there, it connects to the stomach meridian. Here, stomach 6, and from there it goes upward towards the lip, and then it comes down again and meets this meridian at supraclavicular fossa. यहाँ तक समझ में आया क्या?
आ गया सर.
From here, now the path, they both branches meet here at the supraclavicular fossa, and from there they travel downwards from the side of the umbilicus, and then it enters the gallbladder meridian and connects the liver. From there, branch arises and it comes down, circling around the pubic region area. It comes here and it stops at gallbladder 30 point here at the trochanter. Okay.
What is that called?
Trochanter. Deval or
Trochanter, हाँ.
Deval or doctor वो मुझे
Procanto. P for paper.
Trochanter. Okay. Then a straight portion moves down to the near the axillary fossa, near the nipple, and from there, this is the outer branch of the meridian where the points are there. This is the internal branch of the meridian which flows through the stomach, diaphragm, stomach, pubic region, and then it comes here and stops here. Okay, at stomach 30. The straight portion, gallbladder, straight portion comes down through the trunk. It follows this path, and then it connects the preceding branch here at the hip, and again it connects to the gallbladder 30 point at trochanter. Okay. Then it follows the lateral aspect of the lower limb and enters into the second toe. It enters into the lateral side of the second toe. Okay. So am I clear with this? Dr. Archana and Dr. Deval. थोड़ा मुझे
Sir,
यहाँ
very clear.
Okay. Okay. So there is an external flow and the internal flow. Internal flow from the supraclavicular fossa. From the face it comes down. The both branches meet here from the supraclavicular fossa, and this internal flow goes and connects to the gallbladder, and also it connects to the liver organ. Okay. Another branch which comes down from the at the axillary fossa near the nipples, it flows downwards and it goes to the free end of the floating rib, and then again it goes to the pubic area, and from there it goes to the hip, and then it goes and connects to the preceding branch which was already there at gallbladder 30. From gallbladder 30, it takes the medial aspect of the lateral limb, lateral side of the lower limb, and ends at the fourth toe. It ends at the fourth toe and on the lateral side of the corner of the fourth toe. Okay.
Ravi, can you show the fourth toe camera थोड़ा नीचे करके?
एक मिनट इधर
हाँ.
करंगळीच्या शेजारचं बोट पायाच्या.
अच्छा म्हणजे okay.
Fourth toe. This is fifth toe. This is fourth toe.
Okay.
Okay. Now, so it comes down and ends at the corner of the lateral corner of the fourth toe, and it ends over there. Okay. Yeah. Now, a branch at the dorsum of the foot, it crosses the third and it ends at the medial corner of the great toe.
रवी
हाँ.
थोडा कॅमेरा खाली कराल, दिसत नाहीये तो टोचा पोर्शन. हा आता दिसला.
बस.
Okay. So from the dorsum of the foot, one branch arises and crosses the third and the second toe, second toe, and meet the liver meridian at the lateral corner of the great toe. Okay. ये मैं बुड्ढे में समझाऊंगा.
गुड्डे को थोड़ा ऊपर रखना.
गॉल ब्लैडर मेरिडियन के डॉर्सम से वो निकलती है and it goes and meet the liver meridian at the lateral end of the corner of the big toe, great toe. ठीक है?
Okay.
Yeah. So, this meridian is used to treat all the path, external and interior path. Wherever the meridian is flowing, you can treat the problems and the diseases of those organs, like how it goes from the lateral side of the head, you can treat migraine by using gallbladder meridian. You can treat even eye problems by using gallbladder meridian because it starts at the outer canthus. You can treat ear problems. You can treat half headache because the gallbladder moves around the lateral side of the head. Then you can also treat diseases of the shoulders, nape, occiput, and then you can treat all the parts from where the meridian is moving, the chest, the trunk, the hypochondriac region, and thighs, hips. Gallbladder 30 is the best point to treat sciatica nerve problem and problems of the thighs, lateral side of the legs, dorsum. If you in foot drop, we can use gallbladder meridian. In foot drop, you can use gallbladder meridian. Foot drop मतलब पैर ऐसा लटक जाता है, ऐसा ऊपर नहीं आता. मुझे हुआ था, देवल ने ट्रीट किया मेरे को, ठीक है, ऐसा लटक गया था मेरा पैर.
अच्छा रवि, can we use gallbladder meridian for pain in the heel?
Yeah. GB30, best point. Pain in the hip. So
you were saying some calcium, calcicea, something, right?
ये जो हिप बोन का जो है ना वियर आउट हो जाता है.
हाँ.
वियर आउट हो जाता है, क्या बोलते हैं उसको डॉक्टर अर्चना? उसको एक नाम है,
Osteonecrosis, osteoporosis.
Necrosis, some of that.
Necrosis means death of that particular part, आणि osteoporosis means की bone density कमी झालेली असते त्या भागातली.
Even if it is 40% gone, you can recover that hip bone by using acupuncture. Okay, and the main point is gallbladder 30. Gallbladder 30 point is the main point. In sciatica problem, we use gallbladder 30 along with other points like urinary bladder 36, urinary bladder 37, urinary bladder 40, urinary bladder 57, 59, urinary bladder 60. All these points, but the main point is gallbladder 30 point. Okay, disease of the gallbladder, urinary problems, then even the genital problems you can treat with gallbladder meridian, because it moves, internal part touches the pubic area. Okay, so that is how you can treat these problems by using gallbladder meridian. Endocrinal problem by using gallbladder 21. In case of high blood pressure, you can use gallbladder 20 and you can reduce the blood pressure of the person. By using gallbladder 41, gallbladder 41 will reduce the ocular pressure. मतलब आँखों के पुतलियों के आँखों का जो होता है वो उसके अंदर का जो प्रेशर है वो एकदम कम होने में मदद करता है. Immediately, if there is high pressure in the eyeball, then immediately you can put gallbladder 41 point and the pressure will be reduced. डोळ्यातून पाणीसाठी दुसरे हे आहे, त्याच्यासाठी दुसरे पॉइंट्स आहेत, त्याच्यासाठी गॉलब्लॅडर नाही. हे जे पॉइंट्स मी सांगून राहिलो, all these diseases what I am telling you are can be treated by the gallbladder meridian. Okay, yeah, let us revise this tomorrow whenever we will be revising this. Tomorrow 11 o'clock we are going to do revision of all the 14 meridians. Okay, main meridians. Okay, so shall I move to the liver meridian now?
Yes.
Okay. Yeah. Liver. Yeah. See, from GB30, this is how the path will go. From GB30, it will take the lateral part of the lower limb, lateral medial part. Okay, from here it comes here. From gallbladder 41, the branch arises and it goes and meet the lateral corner of the big toe. This branch arises, it crosses fourth, third, and the second metatarsal bones, and it meets the big toe at the lateral corner of the big toe. Okay, what it starts? The liver meridian starts at this point. Liver 1 is liver 1. Okay, this is how the total path of the meridian. All the points which are there on the meridian, that is the external path, and the path which doesn't have points is an internal path. Okay. See, all these paths don't have these branches don't have points. All the points which are there are the external path of the meridian. Okay, it goes from one outer canthus, goes towards the ears, then from the branch it goes up and it circles around here. Then the fifth branch goes here, and the sixth branch comes here and goes into the supraclavicular fossa. Okay. So all the points which are there on the external path of the meridian, they can be used for local and the distal as a distal point to treat the diseases of those organs. Like GB41 can be used to reduce the blood pressure in the eyes, because the gallbladder meridian starts at the outer canthus, and that is why GB41 is taken as a distal point to treat eye diseases or eye problems. Liver meridian of the foot julian. How many points?
14 points.
14 points. Yeah. Okay. Liver meridian starts at the medial corner of the big toe. Medial corner of the nail of the big toe. It enters between the fourth and the fifth metatarsal bone and comes on the dorsum of the foot. It moves, it ascends in front of the medial malleolus, one chin of the medial malleolus. This point is one chin from the medial malleolus, and then it flows upward between the kidney and the spleen meridian. Kidney and the spleen meridian दोनों के बीच में से हो जाता है, and it follows the medial aspect of the leg, and then it enters. It moves above the thighs and enters this abdominal area. This meridian curls around the genital, and after curling around the genital, it then goes into the liver, its own own organ and connects to the gallbladder. Here at this point it connects to the liver and the gallbladder. Okay. Then another branch emerges from the liver and then it crosses the diaphragm, it crosses the lung, and then it moves up, crossing the lung, it moves into the throat area and it goes on to the face and then ends at the outer canthus. Outer canthus, it meets which meridian?
Gallbladder.
Gallbladder meridian. From gallbladder meridian, the branch moves up there and it connects to the du meridian at the vortex. At du meridian, this branch also communicates with the brain. Okay. Then another branch which comes out from the outer canthus, it goes down.
रवि कैमरा नीचे करो रवि. हाँ अभी वो vortex से आगे बताइए.
It goes through the lungs, it goes into the trachea, throat, and then it meets the gallbladder meridian at the outer canthus, and from there one branch ascends upward to the forehead, and it connects to the du meridian at the vortex, and it communicates with the brain. Okay. Then another branch from the outer canthus, it comes down and it curls around the mouth, upper and the lower lip. यहाँ तक समझा?
Yes.
Okay. Then another branch which goes from the liver and it enters the lung. Okay. This is another branch. This is the first branch which goes up from the outer canthus. It moves to the forehead to the du meridian, and then from the outer canthus, when another branch flows down, it encircles your upper and the lower lip, as well as the upper gums and the lower gums. Okay. Then another straight portion which is coming out from the liver only. One goes to the du meridian, another branch flows into the lungs. Okay. Yes. Yeah. So that is already known to you. So this is how it connects. Again, it starts at the lateral corner of the big toe. From there, it ascends to the dorsum of the foot. From the dorsum of the foot, it moves in front of the lateral malleolus, one chin in front of the lateral malleolus, and it takes the medial part of the lower limb, goes to the thighs, and then it enters the stomach area where it encircles the groin area, and then from there one branch ascends upwards and it enters into the liver, which is its own organ, connects to the gallbladder, and from there one branch arises. From here the branch arises and it crosses the diaphragm and enters the lung. From the lung it enters the throat. From the throat, ये बात बराबर नहीं है, ये ऐसा अंदर से होना चाहिए था, ठीक है? So it enters the throat and from there it moves to the outer canthus. From the outer canthus, one branch starts and meets the du meridian at the vortex and communicates with the brain. Another branch from the outer canthus, it comes down and it encircles the upper and the lower lip and upper and the lower gums of gums. Okay. Then one straight portion from the liver which is coming out, one goes to the du meridian. The another branch flows into the lungs and connects both lungs, and also it communicates with the stomach. Okay. So this is extra information I am giving you. It also communicates with the stomach. Why it should communicate with stomach? liver का branch है. Why it should communicate with stomach?
Because mother is mother element, sir. Stomach is the mother of this thing.
No,
No, that's not the logic.
it's not the mother. How come it's the mother of wood? Liver is wood.
Okay. Sorry, water. I thought. Sorry, sir. I'm very sorry.
Okay, because liver helps in lot of digestions as well.
Oh, juices.
Breakdown of sugar, breakdown of digested food. Liver helps in digestion. Liver also helps in what? Another function of the liver. It holds the blood when we are resting. Okay, that we will cover when we'll be doing the different systems, the digestive system, the endocrine system, and all that. At that time, we'll be covering all this, right? So, is it clear about the liver meridian?
Yes.
Yes, Ravi.
Yeah. So, okay. I'll read out some notes for you. Liver meridian of foot julian mainly distributes at the medial aspect of the lower limb genitalia side of the chest. It originates from the dorsal of the head of the great toe, turning upward toward the dorsum of the foot, passing through the point 1 tune in front of the medial malleolus. It ascends to the area 8 tune above the medial malleolus. यहाँ से 8 tune ऊपर जाती है, ठीक है? But that is not important. It runs behind the foot, behind the spleen meridian of foot thigh-in, and it runs further upward to the medial side of the knee and along the medial side of the thighs to the pubic region area. It curves around the external genitalia and goes upward to the abdomen. Then it runs upward and curves the stomach, pertaining through the liver and connects to the gallbladder. From there, it continues to ascend, passing through the diaphragm, branching out in the intercostal region of the hypochondriac region. This is the hypochondriac region. Okay. It ascends along the posterior aspect of the throat and throat to the nasopharynx and connects to the tissues linked with the eyes. Brain running upward, it emerges from the head to meet du meridian at the vortex. The branch arises from the tissue, links with the eye and brain, runs to the cheek, curves around the inner surface of the lips, and the branch arising from the liver passes through the diaphragm, runs upward to the lungs, and links to lung meridian. The dizziness, the diseases of the eye, the disease of the liver, gallbladder, side of the chest, hernia are the indications of the meridian. Tai Chung, that is GB 20, I think. Okay, is used for treating dizziness.
Ravi, could you repeat that, please?
Tai Chung. Again.
Got it. मला पॉइंटच नाही कळला. टायचुंग.
टायचुंग तसं ना हा लिव्हर आपला गॉल ब्लॅडर 20 पॉइंट आहे ना, दॅट इज यूज फॉर डिझीनेस. आता टायचुंग नेमका गॉल ब्लॅडर 20 आहे की नाही मला बघायला पाहिजे. एक मिनिट, आय जस्ट कन्फर्म. गॉल ब्लॅडर 20 लिहा, टायचुंग काढून टाका.
हाँ, ओके.
गॉल ब्लॅडर 20 is used to treat dizziness.
हाँ.
Dizziness, pain in the occiput area, we use gallbladder 20.
Okay, thank you.
Gallbladder 21 is the endocrine point. Any problems of the endocrine glands can be treated by putting gallbladder 21. Especially the genetic obesity which is there, it has to be treated by gallbladder 21. General endocrine deficiency या फिर malfunction of the endocrine glands can be treated by gallbladder 21.
Ravi, what diseases are cured from liver meridian?
See, liver meridian can treat pain in the thighs, in inner of the thighs. It can treat. Liver 8 is a specific point for impotency, treating impotency. Liver 8. Again, yeah. So you can treat all the diseases where the internal branch is flowing, where the external branch is flowing. जहाँ अगर वहाँ के problem like knee, liver 8 is also a very good point for treating knee joint pain. Knee joint pain and knee problems. We use this point regularly for treating knee joints and the knees. उसका जो प्रॉब्लम है, तो जहां से जा रही है मेरिडियन, जहां से जा रही है, इसीलिए ये लिवर 8 जो है ना, ये हम फॉर ट्रीटिंग इम्पोर्टेंसी यूज करते हैं. अब ये देखो, ये मेरिडियन यहाँ से जा रही है, इंटरनल पाथ है ये, फ्रॉम जेनिटल इट गोज अपवर्ड एंड देन इट कनेक्ट्स टू द लिवर. तो ये सारा पोर्शन का जो ये है, यहाँ पर पेन है, तो वी कैन मेक यूज ऑफ लिवर मेरिडियन. देन इट गोज अप लंग, इट आल्सो क्रॉसेस द लंग. सो लंग में से भी जो लिवर मेरिडियन है वो हम क्रॉस कर रहे हैं, तो लंग में भी ये करते हैं. लंग, व्हाट इज लंग एलिमेंट वाइज? लंग क्या है?
Metal.
मेटल. एंड व्हाट इज लिवर?
Water element. So
लिवर इज
liver is what? Wood, sir. Sorry.
Liver is wood. So what is the relationship between the metal and wood?
Metal is the mother of wood, sir. Metal controls it, sir.
So
Controls, sir.
it is the natural control of a metal on wood. So whenever there is skin problem is considered to be excess wood. So what we do, we take out blood intravenously from the lung 5 area and we inject it to the gallbladder 30 point. 3 ml of blood is injected at gallbladder 30 by removing it intravenously at the area lung 5. Lung 5 में से intravenously blood निकाल के एक्सेस वुड को कम किया जाता है. एक्सेस वुड इज स्किन रिलेटेड प्रॉब्लम. व्हेनेवर देयर इज एक्सेस ऑफ वुड एंड मेटल इज अनेबल टू कंट्रोल द वुड, एट दैट टाइम वुड विल बिकम एक्सेस, ज्यादा हो जाएगा. तो उसकी कटिंग करने के लिए हम क्या करते हैं, व्हाट वी डू, वी टेक आउट ब्लड फ्रॉम LU5 एंड वी इंजेक्ट इट इन गॉल ब्लैडर 30 पॉइंट. You do it once a month, you will be able to treat any kind of skin diseases. Any kind of skin disease. Which organ looks after the skin? The whole body skin is looked after by lung. So skin will be what element?
Metal element.
Metal element, है ना? So excess wood can be reduced by putting blood, 3 ml blood at the gallbladder is what? Wood. So we can reduce that wood by putting blood at gallbladder 30 point. Okay. Any kind of skin disease like psoriasis, eczema, pruritus, all these can be treated by injecting 3 ml blood once in a month is enough, and you will be able to treat skin diseases. Okay. Who looks after the scalp skin? Who looks after the scalp? Which meridian looks after the scalp? The kidney meridian. The kidney meridian looks after the scalp, right? तो जो टकला वकला होने का जो हिसाब किताब रहता है ना, वो सारा किडनी मेरिडियन की वजह से होता है। ठीक है, मतलब किडनी मेरिडियन का वीक हो गया अगर एनर्जी, तो व्हाइटनिंग ऑफ ग्रेइंग ऑफ हेयर्स होता है एंड फॉलिंग ऑफ हेयर्स होता है। डैंड्रफ ये भी जो है ये किडनी की एनर्जी के कम होने की वजह से होता है। ठीक है, ओके, सो shall we move ahead?
अभी total points in liver for meridian 14, right?
14 है, 14 है। ये बेटा एक मिनट, देयर इज सम क्वेश्चन। हाँ हाँ हाँ,
कौन सा पॉइंट है
वो काफी सारे पॉइंट लेने पड़ेंगे। उसके बाद गॉल ब्लैडर मेरिडियन भी जाती है यहाँ से, डीओ मेरिडियन भी जाती है ना। तो ये सारे को कंबाइन करके किडनी इसको मेन रखते हुए हम लोग काम करें। ठीक है, उसका एनर्जी को एनहांस करने का होगा, तो किसी भी एनर्जी को, किसी भी मेरिडियन की एनर्जी को एनहांस करने का है तो यू विल हैव टू इंट्रोड्यूस, कौन सा वाला एलिमेंट इंट्रोड्यूस करना पड़ेगा टू एनहांस एनर्जी ऑफ वन एलिमेंट। से एग्जांपल किडनी, which energy which meridian you will have to work so that energy of the kidney meridian is enhanced. बच्चे को अगर रो रहा है बच्चा, तो उसको हम क्या करेंगे तो वो चुप हो जाएगा, खुश हो जाएगा? बच्चा अगर रो रहा है तो वो सबसे ज्यादा खुश कब होगा? हेलो ऑनलाइन, अगर बच्चा, मैं कोई एक्यूपंक्चर की बातें नहीं कर रहा हूं, मैं कह रहा हूं कि अगर बच्चा अगर रो रहा है, बहुत देर से रो रहा है, तो उसको हम सबसे पहले क्या देंगे?
पीठ पे अपन झपटी देते हैं।
झप्पी।
अच्छा,
पीठ पे।
Nourishment.
लेकिन सबसे अच्छी झप्पी किसकी रहेगी?
मम्मी।
माँ की। अगर किसी भी मेरिडियन का अगर आपको एनर्जी बढ़ाने का है तो उसको ना अपनी माँ के साथ मिला दो। अगर आपको किडनी मेरिडियन का एनर्जी अगर बढ़ाने का है तो किडनी मेरिडियन की माँ कौन है?
लंग्स है, मेटल एलिमेंट, लंग्स एंड
तो लंग के ऊपर काम करने से किडनी मेरिडियन जो है वो एनहांस होगा। आइवा, ये हम लोग सीखेंगे जब हम 5 एलिमेंट सीखेंगे, वहां पर पता चलेगा। 5 एलिमेंट्स का स्पेशल 60 पॉइंट्स है। अगर वो सिर्फ 60 पॉइंट्स के ऊपर भी अगर हम काम करेंगे ना, सिम्टम्स को देखते हुए, we'll be able to treat around 90% of the disease. The points on the 60 points are of 5 elements are below the elbow के नीचे और नी के नीचे, सारे नी के नीचे पॉइंट्स हैं, नी के नीचे और एल्बो के नीचे सारे पॉइंट्स हैं। They are called as 60 alarm points. सिर्फ इनके ऊपर काम करने से हम 80 to 90, yes, yeah, Shanmukh,
Alarm points.
huh?
60 what points?
Alarm points.
60 alarm points.
Okay.
You can work on only on those points and you will be able to treat many diseases. लेकिन उसका बहुत सारा कॉम्बिनेशन करना पड़ेगा आपको। किसका एनर्जी हाई है, बाय पल्स टू सी whose energy is high, which meridian is counteracting on which meridian is not acting on the meridian which should act. Like water should control fire. अगर वाटर मेरिडियन बहुत ही वीक है तो क्या हो जाएगा? फायर इन द बॉडी विल इंक्रीज, तो उसको एनहांस करना पड़ेगा। ये सारी चीजें जो हम पल्स डायग्नोसिस और टंग डायग्नोसिस से जब हम देखेंगे तो हम जाके वो पता कर पाएंगे कि एग्जैक्टली कौन से एरिया पे काम करना है। लेकिन वो अभी तक दूर है। जब तक हम अभी इसके बाद में हम लोग जो मेडिकल टर्म्स है, कौन सी मेडिकल टर्म्स है, डिसीज कौन से हो सकते हैं, ये सारों को पढ़ेंगे और उसके बाद में वो 5 एलिमेंट्स के पास जाएंगे। अभी उसको टाइम है हम लोग। वो ले दो मेरे को। नाउ आई विल बी डूइंग रेन एंड द डीयू मेरिडियन। दिख रहा है क्या?
पहला नाम क्या बोला रवि?
हाँ,
ब्रेन, ब्रेन की रेन?
रेन मेरिडियन ना, रेन एंड डीयू दोनों साथ में करेंगे. So first we'll start from the DU meridian, which is the yang meridian, the sea of yang meridian, energy of all the yang meridian. All the yang meridians get connected to the DU meridian, and all the yin meridians get connected to the REM meridian. ठीक है? ये हमने स्टार्टिंग में किया था.
प्लीज रिपीट रवि. ऑल यांग मेरिडियंस.
Yeah, all yang meridians get connected to the DU meridian. And
Okay.
all the yin meridian gets connected to the REM meridian. ठीक है? Okay. Now the REM meridian, the DU meridian starts at the lower abdomen. From there it goes to the perineum. Perineum is the center where the DU meridian meets and to the REM meridian. ये वाला सेंटर को पेरिनियम कहते हैं.
कौन सा एरिया रवि? पेरिनियम.
डॉक्टर देवल, can you explain this पेरिनियम वाला काम?
It's between the anus and the genitals,
It is between the anus and the genital. Okay.
the smaller area.
Yeah.
So it is on the back side of the body.
जो है ना
नीचे आता है मिड.
ये देखो, am I right, Dr. Archana?
Yes, Ravi.
Okay, so this is the point. Yeah, this is the perineum. Okay, where the REM meridian and the DU meridian meets. It is between the genital and the anus area. Okay, so
मूलाधार चक्र.
yeah. Okay, so it starts at the lower abdomen. From there, the meridian goes internally to the perineum, and from the perineum, it arises up, it enters into the spine, and inside of the spine, it moves to the nape. Yeah, here, okay, and from here, it again enters into the brain. Yeah, देखो. Inside of the spine, it moves up, comes here at the nape. At the nape, it enters into the brain. Okay? From the brain, it comes out, connects to the vortex. And then from there, it goes down and ends at the lower teeth. At the lower lip, inside of the lower lip. Okay, inside of the lower lip. DU25 is inside of the lower lip. It is to the upper. To a worker. ये देखो, ये यहाँ पर inside of the lower lip पे end होती है DU meridian.
Okay.
Again.
Yes, I remember this point. We used to give it for Aditi earlier.
Yeah. Now, see, it starts from the lower abdomen. It goes to the perineum. From the perineum, it rises upwards, enters the coccyx and the spine. This is go internally into the vertebral column, and then it comes to the nape. It comes here, see nape here. दिख रहा है क्या पॉइंट? ये
Yes.
ये देखो ये पॉइंट
Yes.
वर्टिब्रल कॉलम में से अंदर से जाती है, यहाँ पे आने के बाद ये ब्रेन के अंदर एंटर होती है. ब्रेन के अंदर एंटर होके ये यहाँ पे ड्यू मेरिडियन को कनेक्ट होती है, एंड ड्यू मेरिडियन से वो नीचे जाती है एंड लोअर पार्ट ऑफ द लिप में एंड होती है. ठीक है, ओके, समझे क्या?
Yes.
So this is how the DU meridian flows from the lower part of the abdomen to the perineum to the brain, and at the it ends at the lower part of the lip. Okay, that is last point is DU25. Okay. Now I will go for the red meridian. Again, both meridians starts at the same level. Both meridians starts at the same level, lower abdomen. Again, red meridian goes and connects to the perineum, and then from there it ascends upward from the genital to the pubic area, and it follows the central line of the body, anterior to the central line, and it moves and ends at the lower lip. Ends at the lower lip, that is red 24. Then from the lower lip, the branch arises and goes upward and enters into the eye region, that is the infraorbital space, and it ends here at the eyes here. यहाँ से दो branches निकलेगी, यहाँ तक एक ब्रांच आएगी, 24 पे एंड होगी, 24 से वो ऊपर जाएगी, और बिफोर गोइंग अप इट आल्सो सर्कल्स द upper lip and the lower lip, and from there the branch goes and enters into the eyes. Okay. Okay. So DU meridian, very important meridian. We treat lot of diseases by puncturing many points in the DU meridian, especially DU4, which is called as Mingmen, which is very useful point in treating sciatica pain, in treating back problems, also treating impotence, okay, and urinary tract problems. With this, we can use the gynecological problems also can be treated by point DU4, that is called as Mingmen. Okay, then it goes upwards, ends in the brain, and ends at DU25 below the upper lip. The red meridian goes upwards, connects all the points in front of the central line of the body, anterior central line of the body. It goes and circles the lower and the upper lip, and from there the branch arises and enters into both eyes. Okay. On DU meridian, there is point named on Ren meridian there is point Ren 12. Ren 12 point is influential point of all yang organs. On yang organs. Okay. Influential point of all yang organs. Yes. Ren 12. All the diseases of the stomach, chest, throat, mouth, and eyes can be treated by red meridian. All the diseases of the
Ravi, could you repeat that, please?
okay. All the diseases of urinary system, genitals, stomach, chest, throat, and face and eyes can be treated by red meridian.
Ravi, can you please show Ren 12?
Ren 12 मैं अभी नहीं दिखाऊंगा. I will show you when I will be dealing with points.
Okay.
Just now we are just learning the flow of internal and the external flow of the meridians.
Ravi, total points in DU and Ren meridian?
DU में 25 है और Ren में 24 है.
Okay.
Ren में ये DU में 25 है, Ren में 24 है.
Okay.
ये Ren 12.
कहाँ पे है? Okay.
It is fortune above umbilicus. Fortune. It is fortune above umbilicus. Umbilicus से fortune यहाँ पे आता है. ये umbilicus है मेरा. ये umbilicus है, ये टू चुन, ये टू चुन, यहाँ पे आता है, फोर चुन.
Okay.
Again, yeah. So this is how we have finished 14 meridians. The path not finished. We have not yet touched the points of the 14 meridian. So we have just understood how the external and internal path of the meridians are flowing. And wherever the meridians are flowing, we will always see that which organ lies underneath, and all the problems of that organ will be treated by puncturing that particular meridian.
Ravi, time is up.
Yeah. Now, see, there are another 6 meridians. Another 6 meridians are there. Okay. All the confluent points of other 12 meridians, they fall on those 6 meridians, right? So those meridians, we'll just see. Ren meridian and Du meridian, they both are extra meridians because they don't have their own organs. Likewise, another 6 meridians are there, which are there flowing inside of our body, but they don't have any organs. Except for Ren and Du meridian, the other 6 meridians don't have their own points. Their point lies on the other 12 meridians. Okay. And what they do? They merge, like Du meridian merges the Yang meridians in it, and Ren meridian merges the Yin meridians in it. Okay. So likewise, the other meridians also merge with the 12 meridians and connect them with the regular meridians. The 12 meridians are called as regular meridians, and the 8 extra meridians are not regular meridians because they don't have organs, they don't have points. Except for the Du meridian and the Ren meridian, all the other 6 meridians, they don't have their own points. But the old traditional Chinese people used to consider the extra meridians as the lakes and the regular meridians as the river. Okay. So lake का मतलब क्या हो गया? What do you understand when I say there is a lake in the town? मतलब क्या होगा?
Storage of energy in that area.
Yes. The reservoir of energy is there in the extra meridians, and the flow of energy is there in the regular meridians. Meridians are collaterals. Okay. So Ren mind is the conceptual vessel. Do mind. Ren mind means Ren meridian. Do mind matlab Du meridian. Do mind. Then Chong Mai is there on another meridian. We are going to see the path of the meridians. Yes, we are going to study all these 8 meridians, 6 meridians. The path of the internal path of the meridians. And they have internal paths only, they don't have the external path. Their external paths are located on different meridians, regular meridians. So, Chong Mai, the vital channel, the Dai Mai, the belt channel, Yang Chio Mai, the Yang heel channel, Yin Chio Mai, the Yin heel channel, Yang Wei Mai, that is Yang regulating channel, and Yin Wei Mai is Yin regulating channel. Okay, all these 6 meridians, we will learn the flow of these meridians in detail, but not now. Later on, when they are required, I will introduce them to you. But just now we will have the names of these meridians, and after Sunday, I will be sending all the notes related to the flow of the internal and the external path of the meridians, so that you people will understand it better and
Yes,
will
thank
help you in studying the subjects. Okay.
Yes, Ravi, thank you.
So this is how we end up the session for today. And tomorrow we'll have group meeting, a lot of discussions, take down the points, whatever is you have not understood or finding it difficult, we will discuss it and we'll sort out the difficulties.
Ravi, tomorrow same time, right? 11 o'clock?
Same time. So because 12:30 onwards, I have patients here, and I have also taken one video of when these students were needling.
Okay.
I will put it on the group later on once it is ready.
Okay.
So you people will know that what these people are doing over here.
Okay.
Thank
Thank
you.
you. Thank you so much.
Have a nice day.
Ravi,
Bye.
can I send you some questions for tomorrow?
Uh,
I have
Just-
2 questions. I'll send
just
it to you on WhatsApp for
just send
tomorrow's
it down.
discussion.
अभी बात करो.
हाँ. I'll write it now.
हाँ, अभी speak up.
Okay. So I wanted to understand that when you said that liver 8 helps treat impotence, is it male, female, and what
Both.
exactly do we
Both.
mean by impotence?
Both.
As in, for example, what conditions will be included in that?
Yeah, in that we have to see other conditions like blood pressure, diabetes. All these things we have to see. If it is there, then we'll have to treat for diabetes and then work on the impotency, male or female. Even the sterility factor you can work on with this.
Okay, so probably erectile dysfunctions in males and other issues in females, similar issues, and
Gynecological problems in women. Yes.
yes, and sterility issues in both.
Yes.
Okay, and one more question: liver holds blood when resting. Could you explain this concept?
Yeah. See, right now, I have around 15 liters of blood in my body.
Hmm.
When I'm sitting down like this, liver is holding the blood, at least 5 liters of blood it is holding. Rest 10 liters it is giving for other metabolism and all. The moment I stand up from here, immediately when I require that blood, immediately the liver will push that blood into the body. If I'm running, then it will send all the blood which is required by the body for actions.
Okay, what I was not able to understand is how is it able to physically store the blood?
Yeah. That is how, it stores the blood, it holds the blood.
Okay.
It holds the blood. हम जब रेस्ट होते अब पूरे 15 लीटर की जरूरत नहीं है.
Hmm.
You don't require 15 liters of blood right now.
Huh.
But if I come out of this chair and start to walk, then liver will send all that blood into the system.
Okay. Okay.
You can just also Google and find out and also tell us next time what findings are.
Okay, I'll do that.
Okay.
Thank you so much. Yeah.
Thank you very much. Thank you very much for.
Bye bye. Have a good day, Ravi.
Bye. So see you tomorrow at 11 o'clock.
Yes.
And we'll
Bye-bye.
be revising all the 14 meridians tomorrow. And very nicely we'll be doing it. And after that, I'll send you the notes. Okay. Bye.
Thank you
Have a
so
nice
much.
day.
Bye.
You
Bye.
too. Bye bye.
Thank you.